Hey, what's up guys? It's me, the Psych NP David C. You've probably heard the term 5150. It gets thrown around a lot in like movies, TV shows, or even just casual conversations. But what does it actually mean? As a psychiatric nurse practitioner, I want to break down what it really is, when it happens, why it happens, and what the experience is actually like. Not just for patients, but for their family members as well. So by the end of this video, you'll know exactly what triggers a 5150, what rights a patient has, and what happens during and after one. Let's talk about it. So before we begin, I just want to let you know I live in California, so I'm going to be describing things from a California standpoint. So a 5150 is a 72-hour involuntary hold. It's a section of California law that allows somebody to be involuntarily held at a psychiatric facility for up to 72 hours. But that can actually be pretty misleading, so we'll get into that later. The purpose of a 5150 is supposed to be keeping people safe when they have a mental health crisis. It applies when someone is deemed a danger to themselves, a danger to others, or gravely disabled. There's similar laws in other states, but 5150 is specific to California. Being put on a 5150 doesn't mean you're crazy. It's supposed to be a legal and a medical safety measure, not a criminal charge. So let's go into the three main criteria for a 5150. With the first being danger to self. This is usually when someone has suicidal thoughts, behaviors, or even attempts. For example, if someone's saying they're planning like jump off a bridge or overdose on pills, those statements make them actively a danger to themselves. But it can also be for other reasons that don't involve suicidal thoughts. So it's not just someone who's like feeling depressed, they have to have an imminent risk. So if someone is saying they have thoughts of jumping off a bridge, the goal is to detain that person for up to 72 hours in a psychiatric facility with the goal of stabilizing them in a safe environment so they don't have those thoughts anymore when they're released. And moving on to the second criteria, which is danger to others. This is when someone has like violent behavior, they're threatening harm, or they just plan on hurting someone. For example, let's say someone says they plan on beating up their neighbor when their neighbor comes home because their neighbor's loud music has been pissing them off or something. Like they plan on waiting in the bushes in front of the neighbor's house, and then when the neighbor comes home from work, they plan on jumping them from behind and like bashing their head into the concrete or something like that. Now that's a very extreme example, but it does meet criteria for danger to others. And the third criteria is gravely disabled. This means a person can't provide basic needs for themselves, such as food, clothing, or shelter due to a mental illness. For example, let's say there's like a homeless person with schizophrenia, and they're having a psychotic episode where they hear voices and have visual hallucinations. Even though they're hungry, they may not want to eat due to those hallucinations being so severe, or like they wander to the street because the voices told them to. So they're not really either a danger to themselves or a danger to others, but they are gravely disabled. It has to directly impact their own survival and safety. Now let's move on to who can actually place a 5150. Not just anyone can do it. It has to be a designated professional. For example, police officers. There's certain licensed clinicians like psychiatrists, psych NPs, psychologists, and even social workers. And then there's also crisis teams and county mental health workers. So like friends and family can't place someone on a 5150 hold, but they can call someone to come initiate an evaluation. Okay, so what happens during a 5150? Step 1 is evaluation. The crisis team or police or whoever arrives on the scene and they assess the risk of that person. If they happen to meet one of those three criteria, then we would move on to step 2, which is transport. This is usually done by ambulance or law enforcement to a psychiatric hospital. Now there's some unique situations, like maybe someone found their friend unconscious on the floor because they overdosed on a drug. That person would be sent to the ER first to get medically stabilized before being evaluated for a 5150. And if they do meet criteria, then they'd be sent from the ER directly to the psych hospital, which leads us to step 3, which is a 72-hour hold itself. Now the 72-hour hold starts when the assessor deems that the person is a risk to themselves, others, or gravely disabled. So for example, let's say someone's in the emergency department and the assessor comes and puts them on a 5150 on a Monday at 6 p.m. Even though it's probably going to take hours for them to be transported to a psychiatric hospital, that time in between still counts towards the 72-hour hold. So their hold would expire on Thursday at 6 p.m. regardless of the time it takes for them to be transported to the psychiatric hospital. And once they arrive at the hospital, they're then evaluated by a psychiatrist or psychiatric nurse practitioner. And step 4 is the treatment plan. This includes medications that are prescribed by the psychiatrist or nurse practitioner, individual and group therapy from therapists or social workers, and things like aftercare plans so they don't end up being on a 5150 again in the future. So from a patient perspective, it can feel very scary and probably even be traumatic, but the purpose of the 5150 is to keep you safe. Okay, so what happens after the 72 hours? If the patient is stable, they can be discharged with outpatient referrals. However, if the psychiatrist feels that the patient is still unsafe, they can actually extend the hold. So instead of being on a 5150, it progresses to what's called a 5250, which is a 14-day hold. Now, the word 14-day hold scares a lot of patients because they think they're going to be there for an additional 14 days. But the psychiatrist can break that hold before the 14 days is up if they feel like the patient is ready to leave. And there's also going to be a court hearing that happens within a couple business days to kind of get like a second opinion from a judge. If the judge believes that the patient does not need to be in the hospital, the judge can actually discharge the patient themselves. So the goal is to stabilize patients and give them resources and not to lock them away. I would say on average, patients at my hospitals that were on 5150s end up staying for about 3 to 7 days on average. So a 5150 isn't supposed to be punishment, it's supposed to be protection. Not every person with a mental illness is going to end up on a 5150. It pretty much only happens during acute crisis. That's why early treatment and support can reduce the need for 5150s. Also, as a side note, many healthcare professionals are mandated reporters, which means that while you're under their care, if you say something or do something that makes them even suspect that you might be a danger to yourself or a danger to others, then they're legally required to report that to the authorities. Again, the main goal for that is just safety. So to wrap up, being placed on a 5150 can be scary, but it's ultimately about keeping people safe and getting them treatment. If you have any questions regarding 5150 holds, let me know in the comments down below. If you found this video helpful, make sure to like and subscribe. I am also on TikTok and Instagram if you want to follow me over there at ThePsychNPDavidC. I do telehealth medication management for adults living in California. If you're interested, there's a link down below. And with that, your mental health just leveled up. You're welcome.